Hello, everyone, and welcome to the Population and Health Sciences Discovery Series session. Over the next hour, you will hear from faculty, students, and alumni of the Population and Health Sciences program. Our goal this evening will be to explore what it's like to earn your degree in this field and online. My name is Kim Lucius. I'm the Assistant Director for Online Programs in the School of Public Health. I'd like the other panelists to go ahead and introduce themselves. We'll start with Dr. Cardia.
Hi, I'm Sharon Cardia. I'm the Associate Dean of Education in the School of Public Health and the Director of the online program. I'm also the academic advisor, and I'm a professor of epidemiology.
Reed, you want to go next?
Sure. Thank you so much. Good evening, everyone, or good morning, depending on where you are. My name is Reed Richards, and I am a current first-year Population and Health Sciences student based out of Atlanta, Georgia, and very happy to be here this evening to share a little bit about what it's been like my first 9 weeks of class.
And Kathy.
Hi, everyone. I'm Kathy Hazel-Schwert. I apologize you can't see me at the moment. I don't have the ability to turn my video on. I'll figure that out. I am a recent graduate of the online Master of Public Health program in Population and Health Sciences. I am also a certified health education specialist. I work in the nonprofit sector of public health currently, and I'm in Northville, Michigan. Looking forward to the event this evening.
Thank you, panelists. Each of our panelists will be addressing the big questions that we expect that you have right now. We encourage you to submit your specific questions using the chat box throughout our session. We're going to try to answer all of your questions by the end of the hour, but if we're not able to get to your questions, we'll connect via email. All right, Dr. Cardia, why don't you kick us off by discussing population and health sciences. What
Absolutely.
is compelling about this discipline? Why choose a generalist degree?
Okay. So first of all, population health is one of these areas that has been around for decades, but when the Affordable Care Act started to get healthcare systems to think about the health of their communities and really think about their patient population as more than just patients, but people that are living in their, I'll call it areas of interest, then healthcare and public health together became more united in trying to figure out how do we make people healthier, not just solve the problems once they get sick. So we felt like this was a big enough challenge that we would create a degree to give people the basic skills to address this big topic. So for instance, what we try in this degree to do is a nice broad spectrum of skills that allow you to sort of think through and measure a population's health, make data-driven decisions using statistics, and how do you communicate to diverse audiences? Because all of our communities are filled with people that have got different interest areas, different social and economic backgrounds. So how do you think about actually sort of the whole population and getting in front of what might be preventable diseases or things that are predisposing people to get sick earlier, or even things like not having the access to healthcare or the treatment. So thinking about systems, what is kind of the ailment in the system that makes it hard for people to be healthy or to get the treatment that they need? And probably the last thing that I'll put on that is that even with this broad kind of view of population health, we recognize that people like also to sort of get some depth in certain areas inside of population health. So we have elective series that allow people to earn certificates in epidemiology, in analyzing health data, environmental health, health behavior, health education, working with communities, nutrition. So those kinds of things are a part of our overarching sort of program, trying to sort of fit kind of the both and the generalist as well as the depth that a lot of people kind of yearn for when they're using this within their own career space, whether or not it's in the job they have or the one they want to get. So that's population health as we spin it. So let me talk a little bit about the two online degrees that we offer. One is an MS that is a bit more focused on the research part of that population and health sciences picture. So how do we do the data collection or the assessment of population's health, more looking towards answering some of the key questions that would allow us to figure out why are people getting sick, whether or not an intervention works. And so it tends to be a little bit more science oriented, quantitative, and it sets people up for continuing to do research, whether or not it's in academia or, for instance, in nonprofits or in corporations that have a research component to them or a research arm to their organization. It also is more sort of focused on a stepping stone to doctoral programs, if that's what you're interested in. But the MS is still, in many ways, pulling on the same basic concepts and skill building, but then it just has one more layer on top of it. For instance, being able to program in the statistical coding languages. For us, it's R. But you could also do SAS and working on an actual research project. The other degree that we provide in this online space is the Masters of Public Health. This is more of a professional degree. We really kind of stress the practice aspect of it, and we try to bring in people's work or their desires and passions for public health into the curriculum. So people have to choose topics, and we try to align them with what would you do with this new skill out in the world, whether or not it's your interest in maternal child health or sustainable environments, those kinds of things. And rather than a research project, what we have is applied practice experiences and a capstone, which is much more of a choice, I'm going to say, of the different genres of public health, policy briefs, policy studies, program plans, community health needs assessments. It could be a brief report that sort of is a data analysis. I don't want to exclude that from the MPH, but people tend to do things that are moving them into, I'll call it, that practice space more than the research space in this MPH. And people go on to use it in all sorts of different kinds of jobs, whether or not it's community health work or, for instance, in local public health. Some people are using it to add to what has been their work in nonprofits. Um, so those are just a few of kind of the ways in which the MPH and the MS are slightly different in their kind of starting place in the careers that they set you up for. Just to sort of round it out, we have developed these programs so that they are 100% online. Basically, each week has a list of videos to watch, readings to do, quizzes, assignments, projects that are articulated, sort of what you need to do by when, and then we host Zoom sessions every week in order to get classmates to really know each other, to know the faculty, to get questions answered, and sometimes to sort of work on exactly the kinds of things that we're wanting you to be able to master in the assignment or to demonstrate in an exam. So these are like more practice sessions in the live Zoom. They're not lectures, for instance. So we think that it's a pretty nice balance between what you can do asynchronously on your own. Maybe one other thing that's not represented here is that we try to make sure that we've got open communication using platforms like Slack so people can share information, they can talk to the faculty, and feel relatively unencumbered in terms of working on their degree kind of when they have the time. And I'm sure that there are people all across the country at different times that are using Slack and talking to each other, trying to answer problems on problem sets. And we, it's one of the great things about Michigan. It's people first, and it's been a great joy being the director of the program. What else, Kim? Ah, now it's time for Reed and Kathy.
That's right. We're going to go ahead and segue into the next part of today's event, and we're going to hear from a student and an alum. So Kathy, can you start us off with why you chose this program originally and how it's working out for you after graduation?
Yes, absolutely. So there were a number of things that I was looking for in a graduate program, and U of M really checked all of these boxes. I knew I wanted to be a part of a reputable university, a well-known name where I knew I'd get a quality education and have a lot of resources and support. I really wanted to have a solid network as I was navigating the important questions of where is my career path going and what are my next academic pursuits. I wanted to have a variety of options for electives and concentrations, as I didn't go into the program with quite as clear a definition of like, what are my research interests as other people might. And I wanted to have flexibility to continue working full time. I was already working in the public health field when I came into the program, and I'm still working for the same organization. I work for a nonprofit implementing evidence-based health education and health promotion programs. Since graduation, I've been offered a promotion, and I've also just kind of generally increased recognition for my new and improved skill sets. So for example, I'm now somebody that my organization can trust to analyze research and translate that into our advocacy materials, and a little bit more respected for my ability to lead a team as well.
That's great. It's good to hear.
Congratulations, Kathy.
Thank you.
Reed, can you tell us why you chose population health, this particular degree program?
Absolutely. So I knew that I wanted to pursue an MPH, and I looked at many programs across the US with online offerings to try and find one that was the right fit. And what's funny is I was preparing to come to this webinar and speak today. I was thinking, why did I end up at Michigan? What was it about it? And I kind of landed on the fact that it's a little bit of a Goldilocks principle for me, actually. So I looked at programs that had so many different tracks and offerings in their online programs that it was almost overwhelming. And there wasn't enough really thought given to the way that the program could be structured. It was more self-led. And that felt really big to me. I didn't care for that. And then I looked at other programs where they might have been more rigid in the way that they were structured, but they didn't actually have a wide variety of online offerings, and they wanted you to come to campus to supplement your online learning. And that felt really difficult because if I'm going to be a full-time employee and be in this program, I don't have that kind of flexibility to be on campus to take the classes that I'm actually interested in. I want to have access to those classes online. And Michigan already packaged everything in a way that was just right. There's enough variety in the courses with the certificate programs and with the different tracks that are available. But in addition, you take your first couple of semesters to kind of learn about public health, get the foundation before you dive into those elective series. The other factors that I would consider in this, in my decision making, are really similar to Kathy's. Actually, I knew I wanted to have a reputable program with a strong alumni network, and you cannot beat the Michigan Alumni Network. That is absolutely true. It was also really important to me actually to factor in finances for my degree, because I was looking at paying for this degree by myself with my family's resources. And there are a number of programs that are significantly more expensive. And Michigan, again, offered that right variety of courses at the right price, which I know is a factor for many people, especially if you're a working professional. Another piece that I really want to emphasize in my decision making was that I wanted to have access to my professors. And I have found so far in the program that we have wonderfully responsive professors and are able to communicate with them through a variety of mechanisms, which Dr. Cardia has already mentioned. And just being able to have kind of small cohort size with access to my professors was really important to me. Yeah, so I'm really happy to be at Michigan right now.
So Reed, you're in your 9th week of your first semester. So tell us what's been going on this week in class.
So I am currently in our public health nutrition class, which is my first time being in any kind of nutrition class. I have my bachelor's degree is in biology with a secondary major in Spanish. And this nutrition class right now, we are focused on developing a 15-page intervention proposal. So I've been working this week on my evaluation measures and the way that I would evaluate the intervention that I'm proposing to address a particular health outcome that has its basis in a nutrition factor. So think about something like cardiovascular disease or type 2 diabetes. There are dietary components that influence those health outcomes. And so how can we address those in a particular community or particular population with a specific intervention design? So we're walking through the entire process of conceptualizing what the intervention will be, all the way to who are the stakeholders you're going to work with and how will you evaluate it? What are the limitations of the proposal that you're developing? And so this has been a little bit different from my first 2 classes, which were our social determinants of health class and our principles of epidemiology class. Social determinants of health also had a paper as kind of our big component, whereas epidemiology, we had more assessments. It was a midterm and a final to really hone in on our specific epidemiological math and evaluation skills in that course.
Thanks, Reed. Kathy, does what Reed described, does that trigger some memories from the courses that you took when you first started the program? Does that kind of track what you experienced?
Yes, absolutely. And I'm remembering that nutrition class fondly now. That was a really good project that she's describing. But more recently, I've been reflecting on another one of the core classes that was on leadership skills in public health practice, where we took a look at what are different leadership styles, what is my leadership style, and what does that mean for how I interact with other public health professionals, but the community at large as well. And while I may not use the terminology from that class in my day-to-day conversations, it really helped me learn more about myself professionally and has really improved just how I operate in the public health sphere. That's another class that I was grateful to have.
Very good. So the next question is for both Kathy and Reed. And Kathy, maybe you go first since you are since Reed's muted at the moment. But tell us a little bit more about how and when you connect with others in the program. So your classmates, your faculty, how do you do that and how often do you do that? Sometimes, people think an online program, I don't get to, build a network, but if you could kind of speak to how you've been able to do that.
Yeah, so while I was in the program, communicating with my peers more formally, I think we connected mostly by Zoom and email, but informally, we had access to Slack, which is another really great way to communicate just like quickly, very similar to text messaging or community boards. And we actually still stay connected that way, other students that I graduated with. With faculty, I would really encourage people to take advantage of office hours. I got to know Dr. Cridia very well that way, and it's just a really great opportunity to get to know the faculty. They really are there to help you, not just with your classwork, but in kind of navigating what are your next steps in the bigger picture. And I see a question in the chat for alumni of the online program who worked while going to school. How did it go? Nearly impossible or manageable? I could answer that now or circle back to it if you'd like, Kim.
You can answer it now, that'd be fine.
Okay. Manageable. I would definitely advise you to think about time management and what that looks like for you, whether that's scheduling out your day or just having an understanding of how you work most efficiently. If you are working full time and you have a family and that kind of thing, which I know a lot of people going into the program do, you will be busy and it will be worth it and it will be manageable, and you'll have resources to make sure that it will be manageable for you and get assistance when you need it.
Reed, do you want to talk a little bit about how you're connecting with your instructors and peers?
Sure. And I'll also speak to the, is it manageable while working full time? That was my number one concern coming into this program. So I was the person at every one of these sessions asking that question to anyone who would answer it. So as far as communicating with peers and faculty, very similar to what Kathy shared already, I would say that our cohort is really deeply diving into using Slack. I think it's a newer tool that was introduced and we are fully bought into Slack. We are constantly messaging each other. We are messaging our professors. We are getting real-time feedback on issues that we might be having. We're collaborating on homework when it's permissible to do so. Some homeworks are meant to be individual assignments. If people are having difficulty with brainstorming ideas, we're coming together in Slack. The nice thing is that you can open it up to the whole group or post something in your class channel or message board, but you can also privately message people in Slack. And that's actually been one of the ways that I've developed one of my friends in the program so far, 9 weeks in, that she and I are collaborating on papers and walking ideas past each other. Like, hey, I'm really struggling on what process measure I need to include in this paper. Can you help me think through what the process measure should be? And just spending time doing that. I will say the office hours, highly recommend, cannot recommend office hours enough. It was an absolute lifesaver in the epidemiology class. So much in-depth time being spent on answering questions on problem sets, addressing issues that might come up in practice exams. We've had access to our professor and any graduate student assistants who are supporting the class through office hours, which has been tremendously helpful. The other thing I'll say too is that accessibility component that I mentioned earlier, having access to your professors, is real. I was on my way to a vacation last week and was arriving at my hotel, and I needed to have a conversation with my nutrition professor about my paper because I didn't feel great about a section I was working on. She and I spent 45 minutes walking through my paper. This is a PhD level researcher, a faculty member, spending time with me one-on-one to talk about my paper for 45 minutes. I mean, that kind of access is just unreal. and I felt much better about my paper after talking about it. So it worked. But just being able to have those moments where you can email a professor, you can email other members of the cohort, you can hop on Slack, you can attend office hours. It's definitely easy to be connected with folks and to find those pockets of time where you're not just talking about class. A lot of people like to linger after class and continue talking about things, or, hey, we're still struggling with this after we've gone through the class session. Does anyone want to stay late and keep working on the problem set? We've done that. So definitely easy to connect with peers and faculty. As for working full-time and being in the program, I would definitely say it's really important, like Kathy mentioned, to think about your time management. You will definitely be busy. Your evenings and weekends, if you are working full-time, will be incredibly busy. You will have some weekends though where you're a little more ahead on things, you feel like you can take some time off, and then you'll have other weekends where, yeah, you really need to buckle down and just be focused on your schoolwork. But I would also agree with Kathy that it's worth it to spend the time on the assignments and the practice materials that are given out on the problem set so that you're prepared for those assessments or for those final projects that you're needing to turn in, because you have typically opportunities for feedback from your professors or from graders so that you can make adjustments to activities and reach mastery really in the content that you're learning. Because that's the whole point of this program. You don't want to leave not having mastered the material. So it's worth spending the time to really dedicate and make sure you reach that point.
I have another question for both of you. Can you tell us what resources, what university resources you have used? What do you find helpful? You know, academic resources, career, wellness.
Anything on campus?
I personally did not go to campus because I was in the program at the onset of the pandemic. So that changed things a little bit for me personally. But I know other students did go to campus. There are opportunities to interact with campus if you want to. That is still accessible to you as an online student. It's up to you how much of that you want to be doing. As far as university resources that I've taken advantage of personally, networking events mostly. While I was in the program, I really liked, there's public health perspectives events is what they're called, where a leader from the public health field comes to talk to current students about their experience and how they got to where they're at. That was a great opportunity to meet other leaders in the field and learn a little bit more about different career paths. So many different events and networking opportunities like that that you can take advantage of. I'm looking forward to diving a little bit deeper into the alumni resources. There's so much to look at there, providing and receiving mentoring. There's events in my own community. I'm often getting emails about things that are happening for alumni in Northville specifically, career resources, even job postings I come by. So there's really a lot out there. I haven't had the opportunity to dive into too deeply yet, but I know that there's a vast number of resources that exist for me currently.
And I would say as an online student so far, you know, I'm 9 weeks in, so we haven't quite tapped into everything yet. Really, I would say the biggest thing is that I'm well connected with Lisa Garber, who's our program administrator. And she is sort of like an advocate for the needs of the students in the cohort, which is great. So I definitely take advantage of her knowledge and just advocacy for our program. And so far, mostly it's been other students and faculty for me that I've tapped into. We're 9 weeks in. I'm still trying to get my sea legs under me, so to speak, and being able to have that connectivity to my fellow classmates and to faculty and teaching staff is really what's most important to me at this point. I think as time goes on, I agree with Kathy, tapping into some of those alumni resources and the networking options that are available will be key. I'll also say though, I'm a representative on the Public Health Student Assembly. So this is a school-wide assembly, and I was nominated to represent our cohort in the assembly. So I'm seeing activities and offerings that our Public Health Student Assembly is working on making accessible to online students as much as possible. If there are town halls, if there are things that are happening school-wide, that the online voice is represented. And so we're working on trying to make sure that online students do have those kinds of opportunities. And we get emails constantly about different events on campus that are also being broadcast live online. So you can take advantage of really cool speaker series like Kathy was mentioning, but also meetings and activities from the huge number of student organizations that are on campus who want you to participate, and they're not going to mind that you're online because you're another voice to contribute to the work that they're doing and to learn about their initiatives and their programming. So it's nice to have that that connectivity even kind of apart. And I would say, again, for me, so far it's been faculty and fellow students, but I could see that changing a little bit as time goes on because we have those opportunities available to us.
I can't see the chat box, but Sharon, Sharon and Chrissy, do we have any questions that maybe pertain to Kathy and Reed?
Yeah, I think that Gabrielle just popped in one that Reed might have already kind of answered right just now, but I will say that on-campus resources, from getting an M card where you can use that to get deals for all kinds of stuff, to the on-campus counseling, it's called CAPS. Things like that are absolutely available to online students. And Lisa is a really great resource to connect you with everything that you're really available to, is available to you. And, Reed or Kathy, if you have any examples of other on-campus resources, feel free to jump in.
The library for advising appointments on paper writing. So this is not something that I have needed to tap into yet, but if the papers get longer, this will definitely be something I'm taking advantage of, so I'm not bugging my poor classmates. But you can actually set up appointments with the library to help you with research papers and projects, with pulling resources, with paper development, and you don't have to be on campus to do that, which is fantastic.
Are there any other questions for Reed and Kathy? Chrissy, anything else?
Not really at this point.
Okay, all right. Thank you so much, Reed and Kathy. We really appreciate your insight. Okay, let's transition to the next section of our session tonight. Hopefully by now you have an idea as to whether or not this program is going to be a good fit for you. So we're going to talk about how to put together a strong application. So Sharon, can we start by talking about the types of students who enroll in our program and are successful in our program?
Sure. Do you have another slide that maybe goes through a little bit about that? So, most of our students have multiple hats that they're wearing. So many of them not only are full-time, but they are partners or they're parents or, caregivers and things like that. So we recognize that it's a full plate for people that are coming into the program. We have people from 21 different states and 5 different countries, and we recognize that by making sure that we've got many of our Zoom sessions and activities that are in the evening. If we start to actually get a larger international collective, we might actually need to go the other way and go really early in the morning. So we are looking forward to, kind of seeing each year what's really needed. Right now, the 7 p.m. in the evening tends to be a sweet spot that most people can get. Um, Everybody in the program has a bachelor's degree that's required, and they've got them from all different kinds of backgrounds. Biology or math or computer science or psychology or women's studies or we've seen all kinds. And we also have got a fair number of people that are in the health professions that either have nursing or medicine backgrounds. And this is one of the great parts of the, I'll call it cohorts. Strength is its intellectual and experiential diversity. So we've got people that have, I'll call it something to contribute to the conversation beyond just their little piece. They get to hear how does it really all fit together. We have a whole range of levels of experience. I love the 2 to 30 plus. We've had people that basically were ready to retire, but then wanted an MPH. And so after a whole career, them coming back to basically, I think what was an untapped passion, they were incredibly helpful as mentors to other students. Um, of course, because this is population health, the top industries that are represented are healthcare or education, social work. We also have had quite a few people from the military that are looking more at that sort of population level, and they're looking for that stepping stone sometimes to their next career, um, you know, basically window to open because they've been within the military, sort of putting through the lens of often healthcare or population health in that setting, and then they're looking for, oh, now what do I do in order to move into the civilian sector? So we have a great plethora of people and experiences in these cohorts.
Sharon, can you talk about what we are looking for in our applicants?
Yeah, I mean, for any kind of graduate degree, we're really looking for a level of academic preparation that would allow you to hit the ground running. It means that we do want some demonstration that you have quantitative skills or sort of scientific sort of thinking. You've taken science courses of some kind, and that could be the traditional biology, chemistry, physics, math, statistics, any of those are good indicators of that. We recognize that not everybody has those in their undergraduate. And so we often will sort of point out, and I'll talk a little bit about that later, but we'll be able to really sort of tell us if you don't have that in your undergraduate, how do you have it in your job? Or what are the things that actually sort of demonstrate to us that the undergrad was the undergraduate experience, but I've got now what it takes to do this curriculum, and we try to lay out what the curriculum is so that it's not a mystery, kind of what we're looking for. Um, we recognize also that for some people, especially the what they did in their undergrad 10 or 15 years ago may not have been as high of a GPA or things that they were really I'm going to say thinking was set up for graduate school, but we do recognize people's professional preparation. So if you've actually demonstrated a level of, I'll call it public health preparedness, but this time it's actually for taking the degree, then that actually filters a lot into our thinking about whether or not this is a good fit for you. We're looking for people with work experience, people that have served or volunteered or demonstrated sort of leadership in communities or in organizations. If you don't have that research experience, certainly is a a great indicator as to whether or not this program is good for you. Another thing that we're looking for you to tell us is about why population health and why sort of Michigan, for instance. We recognize that this is a professional degree, so there has to be a level of commitment to it. It's not like anything that's sort of big and complicated and needed in society. It takes a bit of grit to work in public health. And if you think about just the pandemic that we're in, you can recognize this is not a walk in the park. It takes a dedication and a passion to service for the collective in many ways. So tell us about why, what, help us to understand how this is going to fit for you. Um, and this last piece is that sometimes it really is all just how it comes together in this moment, and we want to know your story. For some people, it's a chance of a lifetime. For other people, it's a transition from one world to another. And it helps us to do a better job of advising and to helping you along the way to know more about you and why this program you think is good for you.
So Dr. Cardia, how can an applicant tell us that they are the right fit for this program?
Well, when we do the review of the applications and what we are, for instance, really going to need to see whether or not this is the right program. We need your official transcripts. We need that statement of purpose. That statement of purpose is really sort of focused in on why public health. The reflective essay is more about you and your unique story. The quantitative statement, it's a kind of weird term to it, but basically we want everybody who hasn't had a strong transcript that demonstrates math, stats, capabilities of doing the quantitative to tell us about why they still think they're going to be good at the quantitative in public health. That's what allows us to know that you know what you're getting into. The last thing we want is to admit somebody who comes in and is then like not prepared to do the work. It is not good for that students. It's demoralizing. So we want to make sure that you've got what you need to be successful in the program. We want something that tells us about your work background, a resume, curriculum vitae, CV. And then we need letters of recommendation that are coming from professional, either mentors or employers or professors, people that are able to reflect on you as a person and whether or not doing this work is in line with you and your dreams and your capabilities, as well as often they're giving us insight into things that you yourself couldn't see because they're kind of ahead looking at what you've been doing. And I'm smiling because some of the letters of recommendation are glowing in a way that I often wish that the applicant could see. I mean, we don't often think of some of our successes the way that our mentors or our kind of employers think about it. We do have a language exam for people who don't have English as their first language. And this just lets us know, can the materials that we are using, which are in English, be able to be rapidly absorbed and interpreted. last year, as well as this year, we have nixed and do not require the graduate examination, the GRE, or any of the standardized tests. We really are doing a much more holistic review. That's where we started. And so we don't really actually need the GRE as long as we're getting sort of these other pieces. We have a priority deadline for sort of the, how do I want to say this? The first look at the scholarships that we can provide, that we want people, if you really are worried about funding and scholarships are important to you, to meet that priority deadline so we can get the review of those applications done quickly. Our final deadline for all applications is May 15th, so that we can start to build the cohort and they can get onboarded. Right now we have about, I think we had 40 students in the, that are currently in their second year, and about 80 that are in their first year. And so at 120 something, this feels like about the right size for us as a kind of limit, because we are so personalized in our work with students. But we really do want you to apply if you think that this program is right for you. I see a question about, is the quantitative statement more a reflective narrative rather than a synopsis? I'll be honest, it could be either. Because for somebody who's transitioned to a job that clearly is now around, I don't know, data analysis. So they didn't have it in college, but they're doing, data analysis and statistics. They've taught themselves, or they've done community college or whatever. They've done Coursera. Then it's just fine for us to see that as a synopsis of the previous work that is relevant to that quantitative need of the program. For other people, it may actually not be that straightforward. And so something that is more reflective of, I don't know, how do you know that you're ready to do quantitative work? Because it may not be obvious to us. And what we're looking for in that essay is for you to demonstrate it to us and to yourself in some ways. Do you think that you can do statistics and epidemiology and put these pieces together? Population health, like many of the population health sciences, has this need to be data-driven, evidence-driven, or evidence-based. So if you can think that way, that's what we need you to tell us, that you can do that. Any tips for applying? Reed, Kathy, Kim, anybody give people a hands-on kind of, what do you think makes a difference in an application? Go ahead.
I was just going to mention about the personal statement. I know the personal statement is usually what gives most people pause when they're applying to graduate school, and it's kind of the thing that makes everyone really nervous. I looked at the statement of purpose as an opportunity to talk about how I came to public health and what my journey so far in public health has been like. And that actually started for me in high school. So I was able to walk through a project I did in high school that actually is not dissimilar from the project I'm writing about right now in my nutrition class, because I really liked nutrition in high school too. But I was able to talk about that project, to then my undergraduate experience, the internship I did at a food bank in my local community, to then the fellowship I completed with the Centers for Disease Control and Prevention, to the work experience that I've now had at the CDC for the last 8 years. So if the statement of purpose feels big to you, that's just one little piece of advice that I would give, is kind of walking through the journey of how you've gotten to where you are at this point that you're ready to pursue a master's, and why Michigan is the right fit for that, because it has the accessibility and the, you know, the faculty and the alumni network and the really nice class and program design that you're interested in, because that's going to help them see, at least in my opinion, how far you've come and that you're looking ahead to what's next.
I will say about the statement of purpose, this is your, and the reflective essay, it's your opportunity to explain yourself, if you will, if you didn't have the best grades, but you know, we understand that things happen in life. So if you feel like your grades aren't strong enough, use the reflective essay, use the statement of purpose to explain, like maybe something happened, you had some stressors in your life. I would also say, if you have something like an obstacle you've overcome, you know, that has maybe gotten you interested in public health, or like I'm a first generation college student, and you know, getting a graduate degree, you know, has my mother has always said, you know, education is so important. That's good debt, she said. When you take a student loan, that's good debt. So you know, telling us you're a first generation student, and you know, this has been a dream of yours, that will Sharon's a softie for that stuff. So I, you know, if you've overcome some diversity, put that in your letter of statement, because that's you know, something to be proud of. If you you know, had some struggles and you've been able to overcome, and you know, that's the statement of purpose and the reflective essay. That's where you want to really pour your heart out to us.
And I think I saw a question in the chat from Christina about if we would feel comfortable sharing about funding sources we explored and how that process went. So this was my second most important consideration after what's it like to be in the program and working full time, was how do you pay for it? And so for me, I made sure that I applied in time to be considered for Michigan scholarships. And you don't have to do anything separate to be considered for those. You're automatically eligible with your application as long as you meet the deadlines for consideration for those scholarships. And there is some money available from the Population and Health Sciences program. And I was fortunate to receive one of those scholarships, which makes a difference in my total cost of attendance. The other thing I'll say is that employers, depending on where you are, can be a great place to find funding. And so for graduate students, it can be challenging because a lot of programs, maybe if you're working full time, you're only doing your studies part-time. But this program is a full-time program. So when you're looking at scholarship opportunities, most online scholarships that you'll look at say you must be a full-time student. Other programs that I looked at, I wouldn't have been eligible for those online or for those scholarships because I was only going to be a part-time student. You are a full-time student in this program. And so you're eligible for outside scholarships. And then again, working with your employer potentially to find funding if they're supportive. And I was able to do that with my employer as well. I do have some support for tuition through my employer as well as my Michigan scholarship.
Well, let's go ahead and move on to the Q&A portion of our session. So if you haven't done so already, please type your questions into the chat box. Unfortunately, I can't see them. So Chrissy or Sharon, if you could help facilitate the questions in the chat box, I'd appreciate it.
Chrissy is doing a pretty darn good job. Now, we've only got a minute or two, so I do want to kind of get All right, so we've got a couple of questions about, for instance, is this program designed to be completed in one academic year? And the answer is no. So we've designed it to go over 2 years. And so it's, it's not something that can be condensed to 1 year. I mean, we can't even do that with the residential program that they're taking all of the courses sort of simultaneously. And I mean, it's definitely a 2-year program. Another question that is in the chat is how many people usually apply to the program each year? That's a couple of hundred people apply. Let's see. Is there an opportunity to work with faculty on research as an online student? Every cohort we've had a couple of students that work with faculty on research. It's a matter of getting those connections and hooking up, with that faculty member directly. And as a, University of Michigan School of Public Health student, this is how the program works. I mean, it's faculty and students working together, whether or not it's in classes or research or projects or things like that. So
Before we conclude, Chrissy, do you want to quickly mention some of the upcoming events we've got?
Sure. So as part of our Discovery series, well, first, thank you for coming to this session of the Discovery series. And hopefully you've been able to learn all you wanted to know about the population health and online degrees. We have a couple of other sessions that'll really help you kind of understand more of the different areas about earning your degree in public health, including a session on public health practice, some that go a little bit deeper into certificates that are available as graduate certificates, more about careers and kind of planning for the future, as well as, and I posted this in the chat earlier, the Invest in You session that is about financial aid. So I will post those in just a second, all the links to register in the chat box in a moment, but we also have a online graduate admissions office hours session that'll be on November 10th. And that is going to be for students who, typically this leans for students who have already started their application to get a chance to talk to admissions about very specific questions to do with their application. And so it's a really good opportunity to kind of talk that out if you're having any confusion or have any questions about, your language requirement or who you should ask for recommendations, things like that. So we will also be sending out a follow-up email with the recording of this session, as well as these links to the next sessions that you can opt into or not. And please do, I've put it in the chat a couple of times, the email address, the sph-inquiries @umich.edu. Feel free to send your questions, and especially your very specific to you kind of questions or your situation, to that email, and you can connect with our student services folks to make sure we get your very specific questions answered. Well, I think that's it. And I think that all of the questions have been answered in the chat box. We'll leave this open. You guys are free to leave the session. I know we're past time now. But we'll leave this open just up on here in case there's some lingering questions in the chat box.
Thank you all.